Now we are open to any questions that you may have. I am anyway. You should. And every flyer I have made sure that I have my email address. So if you have any question right now about the application process, about the selection criteria, you can ask me. And if you are interested in about the content of the training or anything that Ginger can answer, and so I will open the forum for questioning. If you have any questions, you may ask.
Dr. Drew, I think we have one here.
Yes.
Dr. Drew, I actually, not so much of a question, but I do have a comment real quick. I'm currently interning over with Comprehensive Connections through the Big Money Corrections in INA, and I do have clients there that are in a situation where they also have families, young ones as well, where there's what has happened with these clients being incarcerated is also affecting their families, and they do go through a lot of traumatic situations with those connected. I mean, I've seen some of these cases already, or during my training right now, I've been seeing some cases been reviewed to me where they have young ones that are, because of with an adult being away in that situation, it affects them, especially in a traumatic way. Like you said, bullying at school and other factors will fit into this. And so I want to know how I can help with that, or how I can integrate that as well, because I know we were talking earlier about with young transitional youth and families, but I noticed some of them were even in that area where they're about to transition into adulthood. They're like some are young adults.
Yeah, I think that we have formed a committee with Sarah, myself, Paul, and we will consult with Ginger and Carla as well. So where you have there are some field placement where we have to be very creative to make sure that the component of the training is practiced, and we will spend a lot of time to focus on case by case. In the first year, again, I want to reiterate, on the first year we are going to offer 23 fellowship of $10,000 to each fellows. In the second year, we are going to offer 29 fellowship to $10,000 each fellow. In the final year, we are going to offer 33 fellowship of $10,000 to each fellows. If we, and we want to create a community of fellows. I plan to create an online email community so that we get to know where you are. We want to create this community, and if we run it very well, this grant is renewable. This grant is renewable, and I am very interested. I am very interested to create more community partnership, community-led initiative of the university, where this kind of trauma-related research across, another area of interest is military social work, where again there is a very high element of trauma-related practice in there. So I think that across the different field placement that you all have, we are going to sit. We have a committee to sit. If you are a fellow, then we are going to adjust and talk, and case by case we are going to see if some of the component of this training you should be able to implement in your field. We'll make sure that. Yes.
So I have a question about the training. What does the training look like? What is the? I mean, I've been familiarized with the Sparks training and what that entails. I wonder how it compares to that.
Sure. There are half-a-day training modules, and they will be done on Fridays from 8:30 to 12:30, so 4-hour sessions. And each of the trainers has been assigned to a topic or a set of topics. And so it will be instructor-led, but very, very hands-on with the students. So like in the case of trauma-focused cognitive behavioral therapy, that session, you will learn how to do that therapy. You'll also probably be assigned to do the WebCT course, which is actually a certification that you can get during that time that you will be there, so you'll have that extra information. So when you're done with that set of courses, you're going to be able to do that. Now, Sparks is proprietary, so basically what that trainer will do is just give you the highlights of what Sparks is, and if you want the certification or the training later, you can obtain that on your own. But it will at least give you that information of, you have this, adolescent, and they may be going through all these traumas. Maybe they might do best with group therapy, and so they might do the Sparks training, you know.
So the Sparks is incorporated into that?
It's just, basically that, that training module is just different types of group therapy. So Sparks may be suggested, but it's not going to be taught.
And one of the things that purpose of this grant is also to test curriculums. Like we have put together a curriculum. I am doing a lot of literature review. We are putting together a curriculum and gathering data. So most of this for Sparks and others that you see, they are for wide different purposes. But I think that we are giving birth to something that is very social work field level driven, and we are trying to create a new type of a curriculum itself. We are going to test it, retest it over 3 years. Maybe at the end of 3 years we will have a curriculum that's way more conceptually solid, and we have empirical evidence of that our training is providing better skill across, and that is the reason anybody who is a trauma fellow for year 1 is a trauma fellow forever. Right? Your fellowship doesn't end with your 25 sessions that you end. You become a fellow, and we continue to communicate with you, sharing opportunities with you, and create a community. Right?
So do we get to engage in your peer system with that?
Absolutely, absolutely. And we are going to work. I have got a band of people working to create that social, professional networking around this community that we are going to give birth to. Right?
And just to add to that, we have people working in the community right now that are LCSWs, LCPCs that are hungry for these sessions too. And so they're like, really? You're doing, can we come? Can we come? So what we're going to do possibly is take those sessions and modify them for the community to provide professional development credits for the community, maybe on a rotational basis, but not to take away from the fellowship, because we don't want the community just to come into our classroom, because we want that to be a very safe place for people to discuss cases and whatever you need to discuss. But the community is very hungry for the training, and they would like us to see us to develop those into professional development educational credits. And with the work with the Center for Rural Health and Social Service Development, as a part of SIU School of Medicine, we can do that very easily with the help of Kim Sanders. So, we're going to take that a step further too.
In fact, as a sustainability plan for this grant, we had also thought about opening it to the community. Then we thought the student is a very specialized population. We kept it to the student, but we definitely like to, prepare this expertise and offer it to community at some point, surely. Yep.
First, I just want to say thank you so much for this opportunity. I think that I speak for myself and most of the students in here that this is such a breath of fresh air. Like, to have an opportunity that gives us as students this practice when we leave, it's awesome, and the words I just can't explain. But I secondly wanted to ask whether or not we had to focus on a particular set of internship placements, or is it okay to kind of do not any internship placement, but do we have to focus on places that focus on mental health for this particular fellowship, or are we open to?
I think we are open. I think we have school social work. I think even that is the reason that we are working closely. That Paul plays a very important role. Sarah plays a very important role. Even if you have whatever the forums you are, in school and very non-medical setup, but there is opportunity to look at your client from these lenses. They may not be very clinical. They may not be tagged as mental health placement. But we are also working on creating a list of database of various agencies, and this is our first year. The second year onwards, when we are placing students, right now we will work with the first year. Wherever you are placed, we'll work with you. But the second year onwards, we will have the leeway of placing you to a place where we know that if you are a fellow, you're a fellow, then I'm going to work with Paul and Sarah to place you in those agencies in our database where you would be able to work in, and that database is cross-sectional. That includes school, that includes mental health setup agencies and child welfare agencies all across the board.
And the agencies are very excited about the fellows because this gives them someone to work with who really wants to be there, who who's going to do the work and who is hungry, you know, to learn. And that's so important if you are observing a student or, you know, you're the field liaison. And so they're very excited about that. The other thing I was going to say is if you think about doing an internship, say, at a child advocacy center, that's not necessarily mental health, but there's lots of children on wait lists for some of those advocacy centers who need therapy. And they're very open to the possibility of having a student there to do some therapy with some supervision, to be able to do that as well. So we have lots of things that we can do, and I think that the faculty and staff at SIU are willing to work with each student individually. Number one, to find out what they're interested in, what population specifically they want to work with, and number two, just to find that right fit, because it's so important to find that right fit. And so we're, you know, as a core team, we're willing to do that.
I just wanted to say for the young, I forget his name, the young man is Egyptian. Dr. Buckman. He's already sent me an intern job description. Matter of fact, he'll take an intern right now. He's already got one that I know of. But, you know, I thanked him, and I think we're preparing in the ways we can, and he's part of this program. So if you live probably in that neck of the woods, El Dorado, Harrisburg, at least, you know, unless you want to drive a lot. But I mean, we're going to have internships available probably in a good swath of where we already have our internships that are very connected to this program to begin with.
And I don't want to speak for Dr. Buckman, but I work very closely with him, and he's actually creating something different in El Dorado. He's creating a trauma center so that all of the clinicians there will just be given the cases of trauma. And so he's working on some grant stuff and some other things. He's working with the Second Judicial Circuit, you know, on the probation cases and stuff like that. And so if you decide you want to work with Dr. Buckman, he's great. So he'd be a great placement in El Dorado.
And Kim tells me that there are some couple of agencies represented here. If you have, you know, if you want to say something, since we are talking about the agencies, you know, if you want to. Yeah, if you can introduce yourself. And
I'm Linda Rice, and I'm the Associate Director for Lutheran Social Services. We have offices in Marion, Harrisburg, and Vienna, and we do get a lot of interns from the Social Work Department. We welcome every intern we can get. We do have a clinical staff who do counseling for our children and for our parents, and I currently have 3 staff who have been trained in the trauma and are working towards their certifications. So we're always looking for interns too.
that's very, very encouraging.
And Linda is also on our advisory board for Children's Mental Health Resource Network. So.
Welcome.
Gary Lemon, United Methodist Children's Home in Mount Vernon, and we have residential, we have foster care, we have community mental health, and we have probably 4 or 5 clinicians that are specially trained in trauma. We do get interns, and Paul send them my direction.
That's very, very encouraging. Susie?
And I'm Susie Seelock. I'm the Program Director for the Integrated Assessment Program that Dr. Drew has been talking about. We also have an internship possibility. The grant is with the Department of Children and Family Services to perform the integrated assessments for kids that are coming into foster care and their families. And we employ 35 screeners throughout southern and central regions. But we do have opportunities for an MSW student to actually shadow a screener, go into the homes, do the interviews, help with the recommendations for the service planning that would be filed with the juvenile court, and hopefully would be able to bring the children safely back home.
Thank you. Thank you. Any other questions or any community member? Yes.
You know, you guys sound very excited, and you guys have got me super excited as well. I'm so excited, I'm actually getting a little bit impatient about this. Like, I want to know when, where, how do you sign up? I won't be able to do it till next fall, so I'm just kind of wondering, what kind of the timeline is going to be like in terms of applying for this fellowship, and how should we be approaching internship sites?
You will be working with Paul about your, at final year internship. We are collecting email for everybody who is present here. So if you haven't written your name and email, please make sure you do. We are going to create a listserv and keep everybody, informed about how we plan to go about this. But by the spring semester, we are going to, start the recruiting process so that we can recruit advanced standing program and, the people who are coming up in the 2-year program in the final year. That is the pool we are focusing on. So the 2-year program, those of you who are in the first year would be eligible for this fellowship, internally. We are also planning new students who are going to come in the advanced standing program. We are going to, that is one of the reasons that we are trying to create a recruitment drive so that we get the best and the brightest, since this is a great opportunity down in Southern Illinois. So yes, we will keep you, everybody in loop as we move on in our recruitment process. Is there any other question? I think we are okay. Then I will conclude, but before concluding, I also would like to thank my wife Dahlia. One of the reasons that she has also really, she's a English literature person, and finally after everybody's after I wrote that 80-page grant, she went through every single sentence and made sure she did the draft before we, so I thank her as well. Okay, so all right, so I think that we did good with time and everything. Thank you very much for coming. And I hope